As always, we focus on bundles of interventions to help with recruitment and retention of your staff. And today we have a bundle of 5 interventions that we're going to share with you. They include recruitment, specifically around a refer a friend program, stay interviews, ways to support your low wage earners, nurse leadership development, and how to do a people assessment of your charge nurses to determine who has the best charge nurse skills. So let's talk about a refer a friend program. Most nursing homes have a refer a friend program where employees refer someone that they know. If that person is hired, they receive some sort of bonus for that referral. What we're promoting here is that you focus and target your approach to certain people who work at your organization to get the best outcome with an employee referral bonus program. Specifically, what we've noticed is that if you simply take the flyer and put it on the break room wall, you're very unlikely to get a lot of referrals from staff. The best approach is to identify your best performing staff and talk to them with the flyer in your hand about the employee referral bonus program. And the conversation would go something like this. Hey, Jennifer, you've worked with us for 9 months. You're one of our best charge nurses here. We're so happy. You're so reliable, friendly. Your clinical skills are off the charts. Jennifer, we would like to hire more people just like you. We would like to hire people who are your friends. And we want you to be surrounded with your friends that share your work ethic, your clinical skills, because we know that you'll be happier in the job the more friends you have around you. So would you consider referring your friends because we want to hire people just like you? See what you're doing there? Not only are you ensuring that you'll get a referral of someone who's solid, right? But you're also complimenting your new hire who's been with you for 9 months. She is going to walk away from that conversation feeling really good. And you know what? Just because we are human beings, her goal then will to get another compliment just like that from you. And the fastest way to do that would be to make a referral of a friend. In addition, new hires are the best people to approach with a refer a friend bonus program. Notice your new hires performing well. They just came from another organization. They know a lot of people still and are connected to them in that other organization. Ask them for a referral. Ask them who they know who would be good. And of course, for the new hires, you'd have to add something to the effect of, hey, we're so happy we hired you. You're performing so well. Please refer friends, again, who share your work ethic. We certainly wouldn't want to hire someone who didn't share your work ethic and your focus on the residents. Now, a lot of nursing homes get into trouble with an employee referral bonus program because they make the employees who made the referral jump through a lot of hoops. And it takes a long time to actually get the payout. It's really important that you consider what happens if you delay paying the employee who made the referral. What it does is it discourages the employee from making another referral. It leads the employee to go to the break room and say, I made a referral of my friend, but they're not paying me like they said they would. What we've learned now over the course of the pandemic is that the organizations that tweak this program such that they front load the payout to the referring party are the ones that get the greatest benefit and the best outcomes and the most referrals. So we worked with an organization in the second phase of our work, Heritage at Lohman. And as we were walking around that organization, we noticed on a bulletin board the flyer on the left. Notice the flyer on the left. So this organization had a referral bonus program. But notice this flyer. Take a close look. It is classic marketing where the big print giveth and the small print taketh away. Anyone who reads this closely would not make a referral. Number one, they would think that November 15th is come and gone, so it probably isn't in play anymore. But the small print indicates a lot of hoops that have to be in boxes that have to be checked to get the money. And if I was a CNA, I would read that and go, they don't really want to pay me. Now, notice what they did on the right-hand side when they revitalized the flyer. No longer is it big print giveth, small print taketh away. No longer is it like bait and switch. It simply shows people smiling. Research shows that the more healthcare employees can identify that they have best friends at work, the lower the turnover, the higher the retention. Best friends talk best friends out of quitting all the time. Best friends work better together. Policies and procedures, as we know, rely on relationships and people to work well together to produce the best outcomes. When Lohman revitalized this flyer and began handing it out and talking to employees and asking them for their referrals of their friends, they got many referrals and filled many of their vacant positions. Let's hear uh, about their perspectives on Refer a Friend program.
Because it's like, okay, I know someone who I would love to work with, and I know this person is going to fit in very well. And with that in mind, I feel like they tend to bring in good quality candidates for us. And it's nice because, going back to that teamwork, if you work with someone before who doesn't want to answer call lights or doesn't want to help contribute, that's not a person that you're going to refer.
Let's talk now about stay interviews, which are also critical to reducing your new hire turnover rate. So what is a stay interview? Well, a stay interview in what our focus here today is in these new hires. So you have these quick informal check-ins that are part of the stay interview process where you're rounding and you're noticing new hires and you're doing informal check-ins with them. Hey, how you settling in? Hey, how's everybody treating you here? Do you have any questions? Hey, we're really glad we hired you. Um, um, any problems that you're encountering so far? Those sort of check-ins. Stay interviews are a little bit more formal, where you'd be sitting down with a new hire 2 weeks into their tenure with you, 30 days, and then 60 days into it. So these informal check-ins, as I mentioned, it's just important that you really hone in on new hires, know their name, pat them on the back, make sure that you are acknowledging that they're there, that they're working hard to learn your processes and figure out how to fit into your organization. It means a lot when senior leaders know their name, check in with them, and give them a pat on the back early in their tenure. Now, the stay interview where you sit down with that new hire, it's important that you think about, where you're positioning yourself to have that conversation. You certainly don't need to have a desk between the two of you. It's best when you're having a stay interview conversation with a new hire that you sit next to the person on the other side of the desk. And these questions are simply meant as guidelines to get the conversation going. What you really want is to get the new hire talking and expressing how they're feeling about the organization. You want them to leave the meeting with you feeling supported and valued and understood and essentially convinced that they're going to stay. And of course, this is also a perfect time to ask for the new hire referrals and tell them about the referral bonus program that they could tap into. We have all sorts of resources for you in our resource library associated with this collaborative. And so if you wanted any of our quick tips in a written form that you could print out and take to a department head meeting or print out and share with a group of nurses, this is where you'd find it. So go ahead and tap into these resources. Make your life easier as a manager to promote some of these best practices that we are sharing throughout this collaborative. Let's talk about supporting your low wage earners that work for you. As you know, nursing homes employ a lot of low wage earners. Think about CNAs, dietary aides, housekeepers, maintenance assistants, drivers. In fact, the majority of staff would fall into what we would categorize as lower wage workers. And here's some statistics referencing South Carolina and neighboring states in terms of the percent of direct care workers, including CNAs, in poverty or very close to poverty. Of course, red being at the federal poverty level, and the other colors just slightly above that federal poverty level. But essentially, as you know, these folks are living paycheck to paycheck, and some are heavily reliant on state and federal programs to get by. In 2021, the median annual wage for direct care workers in the state was just $13 an hour. I imagine it's higher now, but so are prices, so is rent. It really hasn't changed anything for low wage workers working in nursing homes. Who are nursing assistants working in skilled nursing facilities nationwide? Well, most are women and most are over the age of 37. Most are non-white and most live at or near the poverty level. And because poverty rates are so high among nursing assistants nationwide, as I mentioned, over a third rely on some form of public assistance just to make ends meet. Let's go ahead and run uh, the administrator and the DON of Pruitt Barnwell.
Oh my gosh,
We bend and twist.
Yeah.
And
oh, we're doing that right now. We're doing that right now.
like we
I mean,
said, everybody
everybody
has life issues.
Oh.
Everybody has life emergencies.
Yeah.
But the one thing is, and I'm gonna just use this as an example that, sometimes something's going to happen and you're not going to come to work.
Right.
Something's going to happen. And in those instances, come to us, talk to us, communicate with us, because me and Marianne have life issues, And if we're on the same field and I can understand what's going on in your life, then more people are going to be apt to help you out and cover you. And that's what we do.
So you're much more likely to retain the vast majority of your low wage workers that work for you if you make some investments that really matter to them. Wages and benefits are really hard to nudge when you work for a big corporation. But these low wage kind of wraparound supports for low wage earners are certainly something that you could do. The first is food. There's lots of examples of nursing homes around the country that give free food to their low wage earners, as well as other staples that they need. They order in bulk. They get tremendous discounts from Sysco and other national food distributors. They pay attention to the sales. They pick up massive discounts and they pass that on to their staff in the form of a food pantry. This is an incredible benefit to low wage earners and is very likely to lead to lower turnover and higher retention rates. Another is just a clothing exchange. You organize that staff at a certain time of year bring in clothes that of their kids that they've outgrown. And you kind of spread it around and you let staff pick through, and and save some money through this clothing exchange. Another great idea is giving the staff back to school supplies in the form of purchasing 45 backpacks and stuffing them with school supplies. These are really meaningful and timely. The key is timely access to resources for low-wage earners. In our second phase of the work, we worked with a facility that offered free medical advice and medical clinics to their low-wage earners. As you know, most of the staff earning these low wages rely on the Affordable Care Act. They rely on Medicaid. And sometimes it's really difficult to get an appointment when you're on Medicaid. So having a medical director or physicians offer an hour of time each week for folks to come in and get some advice, it's invaluable. And of course, the cost now of flu and COVID vaccines, these are investments. These are not expenses. It costs money to recruit and retain staff. And if you invest in certain evidence-based wraparound supports like this, you will reap benefits. You will lower the cost of your turnover. Another great idea is helping your staff do their taxes, which can be very costly, and you want them, of course, to do it correctly. In addition, most low-wage earners in nursing homes are eligible for the Earned Income Tax Credit. But because maybe they're a first or second generation immigrant, or English is their second language, most low-wage earners don't claim this tax credit. And it is real money, folks. It is $5,000, $6,000, $7,000. But unfortunately, most low-wage earners leave it on the table and they never claim it. But if you brought in someone from H&R Block, parked them in the break room, gave everybody access to 30 minutes of that person's time, made sure the H&R Block representative took advantage of the Earned Income Tax Credit and went back in years to claim it if need be, we're talking about getting $10,000 in your employees' pockets. And all you did was bring in an H&R Block expert. Make sure your low-wage earners can cash out paid time off without any hoops to jump through. It's their money, and the last thing you need is them to go to payday loans in an emergency when they have PDL money sitting in the bank. Help them navigate what they're eligible for, not just at your facility, but also at the federal and state level. Oftentimes, your social workers are experts at navigating and helping people navigate what they're eligible for that would ease certain financial burdens within their life. In so doing, if you help them navigate, you'll teach them how to navigate to ensure that they get the benefits for their families. Shoes for crews, free nursing shoes, affordable health insurance, and of course, most companies offer some sort of financial safety net when terrible tragedies strike low-wage earners, and that's great to do. But all of these other ideas are really what helps you recruit and retain low-wage earners. You know, I read this fascinating study out of Kansas State University of two researchers who are organizational psychologists, Mary and Michael Lesko-Long. And certain research studies just like blow me away around nursing homes, and this one did. And as you can see, it's quite dated because I'm kind of old myself. But what this study and what Lesko-Long found, who had no experience in a nursing home, but again, were organizational psychologists, what they noted when they were studying turnover in Kansas nursing homes was that the nursing homes that had the most charge nurses, that had the best skills in how they dealt with the CNAs, had the lowest turnover rates, as you would expect. And they noted that when charge nurses aren't getting along with the CNAs, when there's friction and tension between them within any unit, within any shift, call outs and turnover happen within that unit or shift. So they were able to pinpoint the fact that it's charge nurses with good personal skills that can empathize with the CNAs and to treat them with respect that, of course, have the lowest turnover and the lowest call outs. So helping your nurses develop those skills. Think about charge nurses within your organization that seem to have leadership skills, that have CNAs that want to do their best for them, right? I'm sure you have 5, 6, 7 of them. And then at the other end of the scale, perhaps you have some others that could use some polishing. In any event, everybody in the organization, every charge nurse would benefit from a focused effort on helping them to develop their leadership skills. The biggest challenge that DONs face when it comes to developing their nurses is when to meet with them and how to get the nurses to come to your meetings. Of course, it doesn't help when 3 days before the meeting, a sign is placed, at the break room wall that says mandatory meeting, all nurses, Wednesday at 2. Don't expect them to come, right? They're never going to come. They have other things to do. They have other job. And if they're not working that day, they're not coming. Accept that. Flex with them. Have multiple meeting times. But most importantly, just have a predictable day every month with a predictable time so that nurses can rely on it. If it's predictable, they're much more likely to come. Always feed them. Recognize that you're in charge of developing their relationships with one another. So food and drink is critical so that people can be chatting and talking and getting to know one another, which is a key goal of the meeting. Always start on time. Always have it on a same day every month. Keep it 45 minutes or less, and remind them throughout the day that our meeting is here and don't worry, we're going to offer you food and drink. Lunch and learn meetings are really effective if you want to have high attendance. Now, prior to the meeting, make sure you have a good idea of who your best charge nurses are and what kind of leadership skills they have, because these are the ones that you're going to call on to help them teach their peers, right? Nurses learn best from learning from their peers. So you could get the conversation started with, how do we get CNAs to do what they're supposed to do? But scenarios to get you started might work best. And on the next slide, you'll see that part of what we offer in our resources is this exercise that you can use with your charge nurses in this meeting. And this is how the exercise works. All the nurses in the room would just read these 2 quotes of 2 charge nurses at a nursing home in Maine, in the same facility, just down the hall from one another. But note how differently each charge nurse starts their day with the CNAs. The one on the left says, I gather my staff in the morning and I tell them, we have to work together. We're like sticks. If we work apart, each of us can be broken. If we stick together, we can't be broken. We've got to stick together and get the work done. And let's have fun doing it. Then I just pitch in and we get through the day. Just down the hall, another nurse said, I'm overwhelmed by what I have to do when we're working short. If I start doing the CNA's job, I'll never get my meds passed. I'll never get my charting done. It's just too much. I'm not going to do the personal care. I just keep my focus on my work and get as much done as I can. So after the nurses read those 2 scenarios, the facilitator of the meeting would say, hey, nurses, pair up with the person on your left or right and answer this question. Which nurse best reflects how you start your shift with the CNAs? And just get them talking. And after their conversations settle down, start to call on people in the pairs to share their thoughts. And then, of course, again, bear in mind which are your best charge nurses in the room and make sure to call on them. Of course, a rising tide lifts all boats. As you focus on building your charge nurses' leadership skills, you're also building your own. I'll turn it over to Ann Louise.
Thanks, David. So David had just brought up, talking about two different types of supervisors, and some may be, your best, that maybe just needs a little boost to their already, the talents they already possess, and other people might need some more remediation. So whatever the case, we're offering a frontline supervisor support training series, and some of the organizations in the Leadership Academy have taken advantage of it. We just wanted to, give you a little information in case you haven't heard about it, or maybe this might pique your interest. So again, the purpose of the series is to, share these soft leadership skills to boost or reinforce their competencies of your frontline supervisors. It's self-paced, it's online, it's accessible via a phone. There are only 7 modules, and they're composed of a pretest, a learning module, which is short. They're usually around 10 minutes in length, and then there's a post-test, and then finally a brief course evaluation. The topics include the list below. So some of them have, we've asked for evaluations for those who've completed the course, and a lot of them found conflict resolution to be really helpful. Delegation was another interesting one. So they really have, the people that have gone through the course have really pointed out a couple of the really interesting modules for them. And to date, we've had 4 organizations sign up. We've had a total of 30 staff enrolled. As of this morning, actually, 18 learners have completed the course, so we're at about 60%. And then close to 95% of the enrollees rate the overall experience of the course as good or very good. So, if there's, I know that Beth usually sends out an email to everyone after this webinar is concluded. So we'll be more than happy to, again, give you information about the Frontline Supervisor Support Training Series. And if you're interested, if you're already joined and you're an organization, maybe you want to enlist more new supervisors or other people that you haven't thought of in the past. Or if you're interested in the series, it's available to you and it's free. And we've gotten some really positive feedback on it. And so again, just a little closing thought is, from Bill Bradley, I think he was a basketball player too, showing my age, as well as a politician. But he said that leadership is unlocking people's potential to become better. And we hope that this course can help you with your frontline staff. Then I'm going to hand it back to David. And thank you for the time.
When I was 12 years old, I was so privileged. My dad knew the general manager of the Cincinnati Reds. And I went to a spring training facility, and on a chalkboard was the list of all the baseball players in the Cincinnati Reds organization. And they were all ranked and rated according to their skills on this chalkboard. And ever since then, I've been fascinated with this idea of ranking and rating people in an organization just to determine who we needed to develop, who was our best, and if people agree on who is the best. So ever since then in my organizations, I always took the time to sit down with the DON, the Director of Staff Development, the Director of Education, the infection preventionist, the medical director if need be. And we would sit down with a list of all the nurses, and we would have a discussion about every single charge nurse and essentially rate each one on a scale of 1 to 3 based on their reliability, their clinical skills, and their leadership skills. So at the end of maybe rating 25 to 30 nurses in a long conversation, at the end of the day, we would have a list of each nurse with these ratings, with the highest rating being 9 and the lowest rating being 3. At the end of the day, I'd look at the list and I would check off the ones who were the Triple Crown winners, right? 3 for reliability, 3 for clinical skills, 3 for leadership, a total score of 9, a perfect score. How many of those did we have? And I would report that out to the group. Hey, folks, we rated 9 of 25 nurses as Triple Crown winners. And then I'd look closely at the ones that got a 1 for reliability, but a 3 for clinical skills and 3 for leadership skills. And I'd say to the group, hey, if we could just get these ones to come to work more reliably, we would have 12 Triple Crown winners, right? But then we'd also focus on the lowest rated staff and have a discussion around them as well. Where are they lacking? Who has the relationship? Who can have the conversation, and how can we turn them around? Of course, we want to focus on the Triple Crown winners and make sure they know that they're Triple Crown winners. So once we've identified the 9 Triple Crown winners, 9 thank you cards get passed out to the group. Hey, everybody, we're going to write a thank you card to each one of our Triple Crown winners. We're going to put it in the mail. We're going to mail it to their house, praising them for their work, telling them about this meeting that we just had and how we were all talking about what a great employee they are. We'd make plans to ensure that we're retaining them and make sure that we have them on a path to maybe higher leadership positions in the organization. Conversations are critical. People need to know that they're Triple Crown winners if you want to keep their Triple Crown winners. But we also have to make plans to support, but also identify certain lower rated staff that actually might be causing turnover. Research shows in organizations like healthcare facilities where we're highly dependent on other people to finish our work, that bad is stronger than good. Yes, bad is just stronger than good. Employees remember the bad, they remember the trauma, they can relive and tell you about a mean charge nurse who worked there 4 years ago and what she did. People just, these negative thoughts and feelings tend to linger longer in nursing homes than maybe in other organizations. But if you've read any of the books that we sent you, I write a lot about bad is stronger than good. Even in this day and age, when we're so desperate to fill our positions, you still have to let people go who are causing turnover, who are causing discord. Employees, you have to believe that employees are more influential than you in a leadership position, and bad is stronger than good. This is congruent with the theory of relational coordination. Healthcare, relationships matter. Relationships drive compliance to your processes and all your policies and procedures. Policies and procedures assume that people are in good relationships. And if they're not, policies aren't followed. Early in my career as a nursing home administrator, I used to think that the most important relationships were me and each one of them. But as I gained experience, as I read the literature, I came to understand my role really is. My role as an administrator was to develop relationships among them, because that's how the organization became stronger. Of course, this is congruent with Deming, the godfather of the quality improvement movement, who's known nationwide as a data guy. But if you read his work, he was all about relationships, constantly writing about the necessity of strong relationships in healthcare organizations that leads to the positive data. So continue to make those investments that will give you the biggest payoff. Continue to invest your time in being present on the units. Continue to explore ways that you can include people in decisions that are made at your organization. See your role as a community builder. See your role as the mayor of a small town, and the employees are your constituents, and you're the one that's going to build the community and build the friendships and create the climate where staff can make more friends at the organization. Again, research shows that employees say they have a lot of friends at work. The turnover is low. Retention is high. Retention costs money. You have to spend money. You have to be competitive with your neighbors with wages and benefits. You have to staff well. You have to avoid low staffing and high workloads. And of course, HR practices are critical as well. Welcoming new staff, ensuring you have a good orientation program, giving a way for low wage earners to move up in the organization, to learn more, to gain more experience, and to help their families. This is the role we play, and it's a really important role. And thank you for all you're doing for your staff.
Thank you, David, and thanks everybody again. Before we close, we definitely would like to get your feedback for today's session. So I have dropped in chat a link to our feedback survey. So if you could just take just a few moments and grab that link, and there are only 7 questions to the survey, and we would certainly appreciate if you could give us your feedback. Part of what we do on these sessions is bring you updates around the 2 programs that we are offering in addition to this leadership series, webinar series. Anne Louise just shared with everybody about the Frontline Supervisor Support Training Series, our training modules. After this Zoom call, we'll be sending out a follow-up email. We'll make sure that you know how to get in touch with Anne Louise, have her contact information so you can reach out to her if you'd like to, as she said, enroll more nurses or talk about the program. And then the other program in addition to this webinar series is our CNA Preceptor program, which is around turnover management. Frontline Supervisor, just the August update we wanted to give you is a sneak peek into the 5th module, which is about communication. Techniques that you can use for communication is around huddles, rounding, and then most importantly, efficient documentation. So that was just a little preview of the 5th module. And then, as I was saying, with the CNA Preceptor turnover management focus, we're partnering with the National Association for Certified Nursing Assistants. It's over a 30-year program. It has a proven track record for improving 90-day retention rates. So we just want to make sure that during these sessions, we remind you of those additional 2 programs. Those of you that are on the call today may already be taking advantage of both of them, but if not, please let us know, and we certainly want to help you get connected to those. We also want to remind you of our next Zoom sessions. We'll have a coaching session that it is to enhance what you just heard from David. It will be August the 28th. That is a 30-minute session where we want you to share and about what you heard, what you're implementing around retention. And then the next 60-minute session is going to be September the 11th, and they are always at 1 p.m. Eastern. And then we will follow up with our coaching session in September, which will be September the 25th. Just a sneak peek on session 5, which again will be a 60-minute session on Wednesday, September the 11th. And our topics will be retention and recruitment, selection, and adjust culture. Hopefully you've had some time to give us some feedback today. We certainly appreciate it. We will be sending out the follow-up email to, if you didn't get a chance to click on that link, it'll be in the follow-up email along with the contact information about the other 2 programs. We want to thank you, and hopefully you will have a great rest of your day. Thanks, everyone.